In this video, we will discuss about the role of a nurse in NICU. As an NICU nurse, we are caring the tiniest, the most fragile and the most precious patients. In NICU, where the little things matter. So each NICU rounds, assessment and caring of babies are very important in saving the life of the newborns. Let's see what is our role in NICU. First, do proper hand washing. Use hand rub. Observe the baby for spontaneous activity, color, mottling or other specific findings. Check vitals. See the heart rate and respiratory rate is normal. Check temperature. Feel for the core and peripheral temperature difference. See the perfusion and SpO2. In sick babies, check the BP recordings also. Next, see for cannula patency, any swelling or redness in the cannula site. Integrity of the skin should be checked. There should not be any blood stain in the cannula hub or three-way extension. This will cause sepsis by bacterial growth as blood is a culture medium for pathogens. Change the probe every 4th hourly. Check probe site and don't tie the probe too tightly. Now see the surroundings of the baby. See the bed is arranged neatly. No infusion lines or monitoring cables should cross the baby. See any clothes or caps is covering the face of the baby. Look for the warmer output. If it is more than 30%, recheck the probe whether it is fixed properly. If probe is okay, think of other causes of hypothermia. In the systemic examination, see for any signs of respiratory distress or tachypnea. Look abdomen for distension. Feel the abdomen whether it is soft, firm or hard. Check the NG tube position. Any aspiration is there or not. Check for urine output monitoring, passage of meconia. See for last GRBS value. See whether any hypoglycemic episodes in last 24 hours. Daily monitoring of weight should be checked. Collect last 24 hours investigations. Check yourself whether any value is abnormal. Discuss the investigation report during rounds. This will help to improve yourself. Any abnormal values should be reported immediately. Also be aware of the proper nursing care of babies in CPAP and ventilator. See whether the baby is on IV fluids or feed. Check the IV fluid rate. If baby is on feeds, see whether the baby is getting breast milk or formula feed, the adequacy, tolerance and upgrading of feed. If baby is on direct breastfeed, see if it is properly established. What we should do and should not do in our NICU. Maintain proper hand hygiene. Do all procedure under aseptic precautions. Identify the risk factors for sepsis early, like cannula site redness and swelling, probe site injuries while doing procedures like CBG. Use iPad for covering eyes in babies under phototherapy. Maternal education for feeding and KMC and emotional support to mothers. Identify CPAP prone injuries and other skin abrasions. Judicial use of oxygen. Keep noise minimum and maintain a calm atmosphere. Avoid medication errors. Double check dose of medicines. Don't manipulate things and hide our mistakes. By revealing the mistake at correct time can sometimes save the life of a baby. Don't blame others for our mistakes. Accept the mistake and correct it and improve it. You should be alert if these signs and symptoms are present. Sick looking baby, poor sucking, mottling and poor perfusion, lethargic, unconsolable crying, marked respiratory distress, bilious vomiting, abdominal distension, sudden desaturation, hypothermia, high temperature, abnormal movements and central cyanosis. Be aware that it is a teamwork. Effective teamwork in NICU can improve patient outcomes. Being a NICU nurse means being a voice for the ones who cannot speak and an advocate for the ones who cannot fight. So, we are not doing just a job. It is a privilege to be a part of something that touches so many lives in such a profound way. We are truly blessed to become NICU nurses.